Hello and greetings from St. Louis, Missouri, and the home of the Missouri Institute of Mental Health. My name is Tom Pansella with MIMH. Thanks for joining us. This is your first program. Welcome. If it's not, welcome back. We're glad to have you with us again. As always, CEUs are available for today's program. If you click the CEU application link underneath the video window, you can apply for CEUs. It's $10 per person. If at any time during the presentation you would like to submit questions for today's speaker, you may do so using the email questions for speaker link also underneath the video window. We've put up a link to the speaker's slides, and so those are available if you'd like to flip through them on your own, but they'll also be visible to you on the regular video. And so now I'd like to introduce Dennis Trask to you. And Dennis has 20 years of successful experience in helping community anti-drug abuse prevention coalitions, higher education institutions, schools, and nonprofit organizations achieve their goals. He's made contributions as a volunteer, a staff member, an executive director, a board member, and a consultant. He's served and worked with professionals, volunteers, students, and children at over 15 organizations across the Midwest, as well as successful candidates for elected office. Presently, Dennis is in his 5th year as a school counselor at the Imagine Academy of Environmental Science and Math, which is an urban K-8 charter school serving 1,300 students here in St. Louis. Dennis has presented numerous programs addressing public policy issues, advocacy, school counseling, and prevention at local, regional, state, and national conferences. Dennis, thanks for joining us today, and the floor is yours.
Thank you, Tom. I really appreciate that introduction. I'm very happy to be here today, and I'm looking forward to sharing some ideas and some thoughts about public policy and prevention. I've got a number of quotes that I want to share to try and set the stage for this. The first one, the world is a dangerous place, not because of the people who are evil, but because of the people who don't do anything about it. Albert Einstein said that, at least the source that I found quoted him. I think this quote has come across from different authors at different times. And in terms of public policy, for myself, this really hit a nerve. Very often, we run into the situation where people are aware of problems, aware of issues that demand some attention. But we just don't do it. We just don't get out there and do what needs to be done to handle it. And this spoke to me in those terms, that we need to put our best foot forward and do what we can. Otherwise, the evil that does exist in our world will get worse. Now here's another classic one. The less people know about how sausages and laws are made, the better. They'll sleep at night. Otto von Bismarck, German political and military leader. This is certainly kind of a dark way of looking at our legal system. But when you do start looking at things, when you do pay attention to political issues, legislative issues, and you do start looking into the background, you realize that, a lot of difficult things just aren't very pretty. One of the things that I think about is when I was young, my father and I, we tried to build a house. We had lots of help to do a number of things, but anyone who's been in the process of building a home or doing anything in terms of construction, you realize that when you get into it, things aren't perfect. You have to find ways to get things done when you're getting down to it. Now you have to make judgments. You can't just do anything, because then your house will collapse. Well, I think the same thing is true when you're talking about legislation. I think the same thing is probably true in terms of sausage and food. Many people are very familiar with preparing food. And when you do it in a home, you do it differently than you might do it in a restaurant. So that's something to keep in mind, to think about as we go through our session today. Now, I really liked this one. Those who are too smart to engage in politics are punished by being governed by those who are dumber. Now, this one's attributed to Plato, that great philosopher. We run into this, I think. Some people like to hold themselves above political issues. try to stay above the fray, if you will, and I think that's a mistake. If one looks at the world in such a way that, I am above this, I really don't want to get my hands dirty with such a thing, well, if we let that go in a society where we have a representative government, or if we're in a society where we do not have a representative government, if we just let that go, we are going to get what we get. We're going to get those who are interested in doing these things, and they will do what they will without attention to what some of us might want, but don't want to get our hands dirty in the process. Now, for those of you who may remember our world from, say, the 1940s or maybe earlier, Will Rogers was a tremendous influence in our country at one time. Here's one from Will Rogers. Politics has become so expensive that it takes a lot of money even to be defeated. Now, Rogers isn't here in the 21st century making that comment. We hear that very, very often. We hear that money rules politics. Well, as they say, there's nothing new under the sun in terms of political issues. Money has always been, and probably always will be, a major influence in public discourse and public policy. But just think about that. Years ago, in the first portion of the 20th century, a famous pundit, if you will, was commenting about the price of being involved in political issues. It's not new. It was a problem then, it's a problem now, but it's really not new. So we have to keep that in mind, I think, as we go forward here. Now I have a set of questions to go over to try and help us frame what we're doing. When we say things are political, what does that mean? Well, for myself, there's two ways of looking at this. There's a negative, and that's the common perception on political. When someone says it's political, typically, whether it's in public life or the workplace, we're talking about a quid pro quo or an agreement, a kickback, that we're advancing a cause that's really wrong. We really shouldn't be for this by any right standard, but we're doing it for political reasons, for expediency, just to make it happen so that the powerful interests would rule. That's the common image that people have when it's said to be political. Now, I think for myself, what I try to convey and how I try to act in my own life is that political is really simply conducting public business. It's when government considers an issue, when elected people consider an issue, when information is presented to whether it's a local school board, city government, state government, county commissioners, or the federal government, we're really just sharing information about an issue and trying to look at it in a balanced way to make decisions about what is a high priority, what is less of a priority, and how are we going to spend the limited tax dollars that we do have to carry out the business of the people. And that, unfortunately, is just not the case so often. Most people, when they hear or use the word political, they're using as a negative, as an insult, as a justification for why they didn't get that job, or why that road was built in a shoddy manner. So what political means to us is very, very important. And anything that we can do to move our country, ourselves, and our communities, our neighborhoods, and our governments to political being much more of just a way of conducting business, much more of a professional way of handling things, as opposed to that corruption image, we'd be far better off if we could get into things along those lines. Now that does lead us, I think, to that next question I have here, is why are people reluctant to engage in the political system? Well, I think it's somewhat obvious from my previous question. Most people don't want to get involved in corruption. Most people do not want to get involved in things that are just wrong inherently. where some powerful interest that wants a regulation to be waived for them so that they can make more money even though it may harm other people, people don't like that. It's very frustrating. So I think that's one reason why people are often reluctant to engage in the political system. There are other reasons. I think another common reason is many people don't understand. They just do not understand our governmental system. It's fairly complex. We have many layers of government. We have regulations and laws that have been accumulating for many generations now. And as we go through time, those rules and regulations, they can conflict with one another. And we do a lousy job in our country of cleaning up old legislation. We're good at maybe coming up with some new legislation, but balancing that with previous things becomes very, very complicated. So people are reluctant for a lot of different reasons. I think they're reluctant, as I said, because of the corruption piece. They don't want to get involved in things, but also that the complexity of it. Whether it's a local issue, a state issue, a national issue, a county issue, if you will, you have to have some basic knowledge of how the political system works to really be able to make it happen. Now, another piece of all this, though, is also the difficulty and challenge it takes in terms of time to make substantial changes in public policy. People are reluctant because they realize that, oh yeah, it's going to be a lot of work to, say, advocate for some more money for any particular service, whether it's drug abuse prevention, treatment, or new roads. It's going to take some time to really make some things happen. Okay? My next item here, what is public policy? Well, public policy is one of these phrases that gets thrown around fairly often. As I was preparing this, I got some feedback from someone about doing a program on public policy. If you use that phrase, it's sort of like turning a light on, and then the bugs will just scatter because a lot of these reasons I just mentioned, and some people just look at it and they go, well, that's really pretty boring. Well, I don't think it's boring to talk about and figure out ways that are going to help people have longer, healthier lives. I don't think it's boring to talk about things that are going to help our schools be better. I don't think it's boring to come up with ways that reduce children's exposure to lead, which we've done an excellent job of in this country. Once upon a time in the early 1970s, I saw a data point, 88% of the children in our country in the early 1970s had elevated lead levels. That means they were much more susceptible to mental retardation, to death, to all sorts of illnesses, a very serious problem. Well, when our country made some big changes, and we did make some big changes at a federal level, we changed public policy on that. We mandated that lead would be no longer in automobile fuels. We also required that the companies who made paint would not have lead in the paint anymore. By doing those two things, we reduced lead levels from that 88% level that I was talking about down to about 3%, from 88% of young people to 3% by about 2001. So within the span of 31 years, our country made a huge change that just really has tremendously benefited children. Now, that didn't happen overnight. It didn't happen by the snap of a finger, and there were a lot of costs along the way to make that happen, but it was a good thing. I don't think anyone would say or even conceive of saying that that was a bad thing that we eliminated lead in paint. It's a great example of an effective public policy. Now, my next question, I think I've already answered it to some degree. Does it really matter? Well, the lead-based paint issue, that's a great example of, yes, it does matter. There was an obvious, clear health benefit there. Next question, what difference does it make? Well, it's going to make lives much more healthy. Another good example, I think, is smoking. We've had great examples across the country of clean air legislation. We have a number of cities, a number of states that have passed legislation that prohibits smoking in many public places. And the data on that is very clear that those places that have enacted bans on smoking or clean air legislation, health results for the people are much, much better. Smoking rates have declined, exposure to secondhand smoke has declined, the health consequences for those people who are involved, who were being exposed to secondhand smoke, they're much healthier. It makes a great difference. It makes a very great difference for those people. So is it worth it? Well, I think that's an excellent question. There are certainly examples of things that have been attempted that have not succeeded or not succeeded to this point. A very common argument that one does here in the world of public policy and political issues, well, we just cannot afford that. That's going to wreck our businesses. With the clean air legislation, we've run into that here in St. Louis in the recent past. St. Louis and Missouri are rather late in terms of the nation, in terms of advancing the issue. And so when I've been in meetings or at discussions or in events, say at the St. Louis County Council or the St. Louis City Board of Aldermen, business people come out and they say, this is going to destroy my business. I have a bar. If you pass this, the people who come to my bar to drink and smoke, what's going to happen? I was in a meeting where I was testifying along these lines, and I had a local alderperson ask me, Dennis, how are you going to pay for the street repairs in your neighborhood if we decrease our tax revenue from bars and restaurants by instituting this prohibition on smoking? And then the people who might have gone to that restaurant, they're not going to go there anymore. They're going to go out to St. Louis County, or they're going to find some other place in the area, and then that sales tax revenue that was coming into the city from that restaurant or all those restaurants in the city, we're not going to get that money anymore. How are you going to pay for that? And not being an economist, I admitted that. I said, I'm not an economist. I'm a school counselor. I have a background in community anti-drug abuse prevention. I know that the data is very good, that this is a health issue, that people's health will improve. So I think that's an important thing to consider. Now, the other thing that I said, and I do say at this point, is that there are many states and cities around this country who have done the same thing. And they have not destroyed their economies in the process. So once this happens, people are able, businesses are able to survive. So we do have to look at these things and think about the cost. Is it worth it? We have to look at a number of different things. A good example that's an interesting comparison, I think, to think about is speed limits. In the 1970s, we moved our national speed limits on interstate highways down to 55 miles an hour. And that was due to a need at that time to reduce oil consumption. And our annual death rates on highways decreased by about 3,000 people a year. Well, that was a very unpopular public policy change. Once the oil issue changed a little bit, production got back in line, cost on fuel went down a bit, we moved our speed limits back up. And people were much happier overall with that. However, highway traffic deaths correspondingly, the estimate is still holds that about 3,000 people a year die because of having a 65 to 70 mile an hour speed limit on interstate highways as opposed to the much slower, well, just different 55 mile an hour speed limit. So is it worth it? What does it cost? Well, we can look at these things. We have to think about them. We have to discuss them. As a person who works with community anti-drug abuse coalitions, I think this is exactly the kind of conversation we have to help promote and engage in with our communities to get the kind of results and changes that we need. Okay. I have a definition here of political. This is back to what I was saying a little bit earlier. from a professional side. For myself, I like this. I've seen this type of definition before. Politics is the business of setting governmental priorities. Practically speaking, it is the business of deciding who gets what support from the government. Are we going to put money into ethanol? Are we going to put money into higher education? Are we going to put money into roads? How much money are we going to put into all of these things? It's just business. However, as I said before, I'm very redundant on this, but I think people connect with this. Most people just don't see it that way. Their experience has been so negative, or their perception of the process is so negative that they don't want to have anything to do with it. They don't see this as an image, as a practical or real description. And my desire today and very often is to promote this and to try to look for this and try to find ways to help neighborhoods, communities, discuss things in ways that are much more open, honest, and trusting that we can work things out. We may not get all that we want at any one time, but we can find ways to work things out to make our world a better place. Now I've got a list of different public policy opportunities. This is a list that I developed. I've looked at different initiatives around the country, here in St. Louis. The first one is very much an issue here in the St. Louis area. Current DWI enforcement and judicial administration. In the past year, the local newspaper, the St. Louis Post-Dispatch, has run an ongoing series about some problems, some very serious problems we have with the enforcement of DWI laws. We have many, many municipalities in St. Louis. We have over 100 municipalities counting St. Louis City, St. Louis County, and then numerous smaller municipalities within St. Louis County. And those smaller municipalities, they'll have their own municipal judge who's handling DWI enforcement cases. So what's happened there is a person will get arrested in one municipality. They'll go to court. So it comes up as a first-time offense. Then they'll go to another municipality. They'll get arrested there as well. And then we have 2, 3, 4, 5. It's really horrific how many repeat offenders we've had in our system where law enforcement arrests a person, they go to court, and then the next court is unaware, or that court is unaware of the previous history of this offender. So we have a person who's repeatedly violating drunk driving laws. They're getting caught. They're not getting the treatment or the judicial consequences that they need, that our community needs to help them with their drug addiction problem. Very often we are talking about people who are drug addicted, or they may be abusers. They may not be addicted, but they're not getting the services that they need to make a change happen. And the consequences are horrific. We had a number of cases locally. In researching this a bit, it is a national issue. There are solutions to this. The governor here in Missouri has proposed, he created a task force. A number of proposals have been developed. I'm not sure where they are in the legislature at this point. With our budget situation, like so many states around the nation, we have a very big challenge with that. Because one of the prime solutions on this is simple, but it will cost money, is divert all of these cases to state court. Well, that's going to add to the state court burden, so we're going to need enough judges and enough judicial staff to make it work. So I think that's a huge need, a huge opportunity. The solution is pretty clear, but the solution is going to cost some time, effort, and some money. Okay? The next one that I've listed, advertising of alcohol and public transportation property and vehicles. In the last year, that's another local issue. I was looking at things over the last few days in Boston, Massachusetts. This is a big issue there as well. Transit systems, they need revenue. They will sell advertising on their vehicles, on their trains, and they can get some revenue from that. However, if they're promoting alcohol and tobacco in a public venue, that sends an interesting and conflicting message. One of the common issues in community anti-drug abuse prevention is urban neighborhoods where you see a high prevalence of tobacco and alcohol advertising, billboard advertising, and community leaders across the country have been fighting against that. Well, when the city bus, the Metro bus, comes in with that same alcohol ad on that bus, that's going to be very defeating. That is very defeating to the community leaders who are trying to change that environment. They want an environment that's more conducive to non-use than an overprevalence of use, which is a common issue, and is listed as a risk factor by a number of researchers. Hawkins and Conolato of the University of Washington list high incidences of alcohol and tobacco advertising as a risk factor in communities for drug abuse by young people. So how do we handle that? How do we advocate with our transit agencies that this is an issue? We want this to change. We don't want our community to be subjected to this type of advertising in our public venues. We wouldn't want this, if we were just looking at the health issues here, we do not want this. Now they have the counter argument of, well, you know, it's legal to do this advertising, and we need the revenue, so why should we not do that? Well, if we do that, we're really in a race to the bottom, and we're going to lose. We're going to pay a price. They may need that revenue, but that revenue that they're getting is there's a payback on that. If we're looking at the overall health consequences to young people and adults for increased use and abuse of alcohol and tobacco products, there's a financial cost there to law enforcement and healthcare. We have to consider that as well. Okay. Another policy opportunity that I think is important to consider. Here in St. Louis City, we have pretty common sales of cold 40-ounce beer and malt liquor. And if it were just up to me, I would eliminate the sale of, I'd advocate for the elimination of the sale of cold 40-ounce beer and malt liquor. You know, it's pretty simple. It's a delivery system to get drunk pretty fast on your way home from work. And if you've lived in an urban area, worked in an urban area, you just know that that's the truth. That's the plain, simple, clear truth. A few years ago, we had the problem here in St. Louis of broken glass from the glass 40-ouncers. Well, we eliminated that. There was an ordinance passed that eliminated the sale of the glass bottles because we had broken glass in parks. It was a hazard to children. And this just doesn't happen in St. Louis. It's really a nationwide issue. So that's been eliminated here in St. Louis in terms of the broken glass. We just by simple legislation saying, no, we're not going to have that. I think we could do the same thing with the aluminum cans, 40-ouncers. Now, if people want to buy those, we could certainly sell them, but not cold. Because if you just can't wait that long, you know, you're going to be drinking that as you're leaving the convenience store. And we're really very often, we're talking about very small stores in neighborhoods that sell primarily, you know, the vast majority of their sales are tobacco and beer. It does not make that neighborhood a good place to be. I don't think anyone can rationally make a counter argument to that. Now that's up to local policymakers, alderpersons to deal with that. And there are those who would say, you know, we're interfering with someone's right to sell a legal product. Well, I think that we have good evidence on a number of fronts that selling legal products is fine, but when there is a health issue involved, a community and public health issue involved, we have plenty of examples of legislation that stands up to constitutional challenges that makes it perfectly legal to do things like that for the benefit of the public health. And the smoking bans and clean air legislation is a plain example of that. Another opportunity, but also I think a big challenge at the same time, state and local funding of prevention and treatment services. The state of Missouri is looking at a current shortfall of $500 million in its annual budget, and that's just the latest in a long line of state budget problems. Illinois, our sister state right across the river, they're looking at an $18 billion deficit in their budget. So how do we fund prevention and treatment services? How do we advocate for that in an environment where government services are being slashed, money is dried up because of the economy? Well, I think we have to continue. We have to look at this in a long-run view. If we don't, certainly right now, if we just look at it for the next 6 months or year, we're up a creek. Now, if we look at it long-term, the economy will turn around. We can't stop advocating at any point in time, though, because people will just lose track of us. We're hardly on the radar screen as it is now in terms of prevention and treatment money. We have a great case to make. There's plenty of data out there that treatment works, that prevention works, that it saves money, that it makes lives better. One of the things that I'm fond of quoting is in the 1970s, our drug abuse by young people reached all-time highs. From that point to now, we've made substantial reductions, significant reductions in the numbers in terms of young people using and abusing drugs. Our prevention efforts are working. Treatment modalities are much more evaluated, much more well-known, much more familiar than they've ever been. We have data to share, to show to policymakers what we know works. We need to do that. We need to do that now. We need to keep doing that because it's going to pay off. Now, we may not get that money now. We're probably not going to get that money now. It's a nationwide issue with our economy. But if we let up now and let the negativity of the dire budget consequences, situations that we're in, override and cause us to just give up, it will hurt us. It will hurt us. We have to stay after this. Okay, increasing fees on alcohol and tobacco. Now, I've run into this. The Marin Institute in California, they're a very strong advocacy agency. They are tracking states that are looking at increasing fees on alcohol and tobacco at this time because, sale of alcohol and sale of tobacco is pretty inelastic. For those who aren't into economic language, that means that just because the price goes up a little bit, that sale is still going to happen. Alcohol and tobacco, tobacco prices have gone up quite a lot, but we have to look at that. If governments are looking for sources of revenue, those are ideal places to look. Now, there are those out there who are going to fight that. The industry is going to fight that. There are going to be those people who say, why are we putting these taxes on the backs of that middle-class person who just wants to have a beer and maybe smoke a cigar from time to time? Well, there's a big payoff. There's plenty of data out there that indicates that higher costs on these items do reduce the use and first use by young people, and we certainly could utilize some of those funds to help with prevention and treatment services. So I think that's an opportunity for us to consider. Limiting access to certain prescription drugs. Methamphetamine, I always have trouble with the word, but the products, sufedrin, the ephedrins that go into meth, those once upon a time were prescription drugs. It was not in the too distant past where they became non-prescription. Places, states, municipalities that have enacted limitations on the over-the-counter sale of the ephedrins have seen reductions in the production of meth. So that's something that's worth considering. Meth is a very serious problem in many communities, and many communities have utilized limiting access as a way to combat this problem. Now, what else? There's really no limit. As a person who currently I work with a group here in St. Louis called Happenings for Youth, a community anti-drug abuse coalition. There are many coalitions like this throughout Missouri and throughout the country. What else? Well, it's really up to folks in those communities to come up with what else. There's a variety of things that could be done. I just have a list here of things that strike me as important that I've identified from different sources, locally and nationally. So for me, these are just starting points. These are things that I would advocate for, but I think other people in the audience would probably come up with some other things. Now, one way of prioritizing is to use a simple SWOT analysis. Strengths. One just has to look at the attributes of an issue, what's helpful in achieving an objective. Now, I think data is very important. I think research is very important. But you have to find a way to communicate with people to make it come to life. You have to have a hook. You have to have something that when you're talking with your neighbor, when you're talking to an elected person, they're going to remember that. Mothers Against Drunk Driving, they are a very effective advocacy organization. They saw a huge problem and they presented data, but they also put a face on the problem, and they still put a face on the problem. When someone gets killed by a drunk driver, they bring that story to life, to neighbors, to people, to communities, to cities. They let people know about the pain that happens when a child is killed, when someone's father is killed, when a mother is killed. They put a face on it. They make it real. That is an attribute. That's a strength. Whatever the issue is, we have to look for those attributes that will communicate to other people things that will stick, that will make a difference, that will help people see the need to make this change. Next step in this analysis, we have to look at weaknesses. If your case, if your issue is weak in some way, we have to look at those attributes of the issue that are harmful to achieving the objective. If we've got some issue that is really, really complex, that's hard to explain, that has multiple sides, that there's no clear, solution to the issue, that there's so much opposition, we have to think about that. We have to figure out ways to either rethink, reframe, or maybe find another issue. There are plenty of issues. That short list I had, there were a number of issues there. We don't have to do them all at one time. I think sometimes community organizers, people involved in coalitions, we can make the mistake of just trying to do too much all at the same time. Sometimes we just need to pick one issue. What's the one issue that we have the best data on, that we have the best case for, that there's the most interest in? Here in St. Louis, I think the DWI issue is a good example of that. The Post-Dispatch, the major daily newspaper, they also have a huge web presence. They did a series. It was very impressive. It was consistent. They called attention to the issue. So that had a lot of strength. And it was very clear that this was a problem. People were dying. And also it had the item of a system out there that people expect the judicial system to work well. Well, in this case, it was not. Something was wrong. It was clear something was wrong. So it really didn't have a weakness other than it's going to cost some money to make that change. The governor appointed this task force, so it got some high-level visibility. We'll see how it plays out in the legislature. Opportunities. What are the external conditions that are helpful to achieving the objective? What are the things that are going on? Is there great interest in the community from different directions to make something happen? The DWI issue. There was so much attention. I think it's the type of issue that touches many, many different people in a lot of different ways. That's an example where there are probably external conditions that were helpful to achieving the objective. Also, I think elected officials, they are usually looking for things that they can make some positive difference with. So I think that got the governor's attention. It got other elected officials' attention. So I think that's a case where that was a good opportunity. Threats, external conditions which could do damage to the objective. A good example of that is probably raising fees on alcohol and tobacco. The industry is dead set against that. They have well-funded lobbying operations. They're going to work against that. They also have their customers who are going to work against that. So that's an example of a threat. It's an example of an item that we have to keep in mind. Let's see now. So when I did this before, I had a regular audience in the room, and so I'm just going to discuss this a little bit myself. But We have that list of different policy opportunities. So which issue has the most strength? I've talked about that as I've gone along here. For myself, for this vicinity right here around St. Louis, I think the DWI issue is probably the one that has the most strength for some of the reasons that I just mentioned. It got lots of visibility. It's clearly important. The consequences of not taking care of it are grim. People will die. It strikes the average citizen as just wrong that someone gets arrested in one community and they have 2 or 3 other offenses for the same, other arrests for the same offense. It just strikes people as wrong. So, and we have a system in place that should be handling this well. So, to me, I think it's the type of issue that has a lot of strength. And for St. Louis and Missouri, I think it's, of the ones that I listed, I think it's just one of those things that people would like to see it change, and it should change, and hopefully it will. Now, which issues are the weakest? I think anything where we're talking about increasing taxes is a very problematic type of item to advocate for at this point in time. When the economy is down, there are strong arguments to be made that we'll never tax our way outside of a recession, and it's very difficult to increase fees and taxes during that type of climate. At the same time, I would never say we should not keep pressure on for that, because I think there is a strong case to be made for taxing alcohol and tobacco, putting fees on those items at appropriate rates to meet our needs. And we do have tremendous needs in terms of drug abuse treatment and prevention, not to mention mental health services. So I think of the items we just discussed, I think that's probably the one that may be the weakest. What opportunities exist that would help support each of the above issues? I think I discussed a number of those. If there's anyone coming in with questions or comments on the web, I'd be sure happy to hear those at any point. But the opportunities that exist, I think one of the things I'd think about besides that DWI item would be, I think I'll just stick with it. I think that's my favorite. Now, what threats could damage the case for each of the above issues? I think that's one that each community has to really address themselves. So much of my work is involved in a community level. I think that each community has to look at those items themselves and find those things that will work in their communities, that will make a difference. Okay. Now, I do have a number of different resources to help folks with this presentation. For quotes, I like this first one, thinkexist.com. They have a variety of different authors on different subjects, and quotes, they're a really fun way to approach an issue in kind of a quick and thoughtful way, and it's a great way to start discussions. Also, I like this website for some other reasons. If you're into book discussions, they can help you with that too. A great local resource for drug abuse prevention and treatment and support services is the National Council on Alcoholism and Drug Abuse. Now, they are part of a national organization, but I have the local website posted here. Now, here in the state of Missouri, an excellent resource in terms of drug abuse prevention is ACT Missouri. They help with advocacy, and they help with community coalitions to work to prevent drug abuse. Now, a national organization, an excellent national organization along those same lines, is Community Anti-Drug Abuse Coalitions of America. They are a preeminent resource in terms of training and support and resources and information to help communities go through this type of process that I've just been describing to help identify priorities and things that they can do to make a difference in terms of drug abuse and drug abuse prevention. Another national group, Join Together, they have information about drug abuse prevention. They do regular email updates They have a weekly update in terms of research and information about prevention and advocacy, so I'd recommend them as well. And then those who are interested in advocacy, there's a lot of rules around that one needs to be very familiar with to do this effectively and to do it within the law. The Center for Lobbying in the Public Interest, they are an excellent web-based resource that can help organizations take care of that need. So I really appreciate the opportunity to share some thoughts and ideas and information. I enjoy this very, very much, and I hope the audience had some fun with this and got some benefit from it.
Well, thank you, Dennis, and we'll take questions from folks. You click on the email question for speaker link underneath the video window to submit questions. Dennis, we do have one question in so far. You mentioned several times the potential tax on tobacco and alcohol products. And do you have any way of addressing the ethical concern of taxing people who are addicted?
Oh, well, I think that's an interesting question. The research I'm most familiar with in terms of prevention is pretty commonly accepted that within the field of prevention that higher cost does make it somewhat prohibitive for young people to start. Now, as for the ethical issue of someone who is addicted and then taxing them on top of that, wow, that's an interesting thought. I recognize that addiction is difficult. That many people who do go through treatment, whether you're trying to stop smoking or whether it's alcohol, it's not. Fairly often, it's not a one-time treatment that addresses the issue. So I don't have an easy answer on that. I think I look at that from a perspective of we came into the era of user fees back in the 1980s, and they've become more and more common. And to fund a particular item, our government has moved in the direction of taxing that particular item that's related to the issue because it's frankly an easier sell. So in terms of the negative ethic of that for those who are addicted, I don't have a nice way to solve that, and it would be nice, I guess, if we could find another way to fund that needed service. But I'm just not aware of what it would be.
Thank you for your comments, Dennis. And I'm Danny Wedding, and I direct the Missouri Institute of Mental Health. And frequently, I tell people about the work that we do at MIMH. And when I meet with legislators and policymakers, I sometimes make the claim that every dollar that we invest in prevention saves the state $13 in the long run. And I've that figure stuck with me, that $13 return on investment. And I'm wondering, among people who work in the public policy arena, if there's any general rule of thumb about the return on investment for prevention dollars.
I'm not aware of a general rule of thumb. I know that CADCA, they have some good data out on the dollars that prevention invested, that the benefit is. And I would think that your estimate is pretty accurate.
Well, I'll keep saying 13 to 1, and I'll quote you if anybody challenges me.
It's really a fascinating thing. I used to direct a community development corporation, a very small one here in St. Louis City, and if mental health and treatment had the same level of need in terms of presenting outcomes as like the money that goes into housing redevelopment, I think we'd have a few billion more dollars. I'm probably going to offend someone out there in the community development field by saying that, but I think it's really, really true. Community development block grant money and things of that sort, they really don't have the same economic rigor. And part of it is that it's bricks and mortar. People just know when they see a new building go in, they know that it's of value. They know it's important. They know that it helps. And so we're in the social sciences, and we have to present numbers. And we present numbers, and still people kind of doubt it. You know what I mean? And you've been there, Danny. They just kind of, man, they did a great job. They put a face on it. They've put a face on their issue, and they've been really successful at that. And I think one of the things that you're just making me think about these things. If we can come up with better ways to put a face on the value of what we're doing, I think the young people that ACT Missouri, they utilize this very well. They involve youth in their drug abuse prevention advocacy work. The Missouri Youth Adult Alliance, they've been active for many years. And so when young people who are benefiting from prevention programming make a presentation, that's a helpful thing. But it's just an interesting and complex issue.
And of course, it's very difficult for those of us that work in the field of prevention, because if you actually prevent a person from becoming addicted, you never see the results of that prevention. At MIMH, we're very invested in preventing fetal alcohol syndrome, and so we have lots of pregnant women who don't have children, right, who are exposed to the toxic effects of alcohol during pregnancy, but you don't see that. It's
right,
not tangible, and yet we estimate that for every child that doesn't get FAS, that we save the state about $1 million, and that's very powerful. And a follow-up question I had is that a dilemma that we seem to confront and that really bedevils the public health field is that oftentimes politically popular programs like DARE, we know are ineffectual. We have some science suggesting that DARE doesn't work. It doesn't. It's not very helpful, but politicians like it. The police like it. On the other hand, we know that needle exchange programs are highly effective in preventing the spread of HIV, but politicians hate it.
Right.
And so there's this disconnect between science and public policy. And I wonder if you could comment on that.
That's a good one. Chris Kelly is a state representative from Columbia, Missouri. And I got to know him a little bit back in the 1980s. I did this internship in the legislature. And he put it really well, very bluntly. I was in this meeting one time, and he said, there's nobody out there advocating for crack-addicted moms. People just want to put them in jail. And truth be told, a lot of people just want to kill them. That's just a blunt truth. People get so angry about such a thing. They just think, how can a person do such a thing? And they just don't see it with more rational eyes. We have a lot of issues that we just don't see with rational eyes. And so how can we make that case in a more rational basis and try to advocate for those things that we know are more effective? And that's a huge challenge. That needle exchange one. If I'm telling the truth, I would like it if we didn't need to do that. But I think maybe the comparison is, sometimes, I've had a friend who not so long ago, he had diabetes and he wound up having a leg amputated. And that was the treatment that was necessary. And so the needle exchange to reduce harm, that was the treatment that's necessary. Now that's kind of a bit of a long conversation to have with about a public policy issue with a legislator. So having that a little bit more time, or figuring that case out to put it in, I was talking about how do you put a face on it, and we've got to put a face on it in such a way that that we could have some success with it. It's a huge challenge. It's a huge challenge.
All right, we've got a few more questions here. The first one I think is fairly easy. Somebody would like you to repeat the website for the quotes under the topic of local resources.
Sure, that's thinkexist.com.
All right, next question. What do you think about states like California that approve the use of marijuana? After watching a documentary the other night, it appears that almost anyone can go to Oakland with a card to purchase marijuana. How can this help with prevention?
Yeah, it does not help with prevention. I was in a workshop about 1.5 years ago where a group from San Diego was sharing their concerns about how they were addressing the explosion of medical marijuana in the San Diego area. And they did a very elaborate effort to work on that issue. What they did was what was happening was outdoor concerts. San Diego, for those of us in the Midwest, outdoor concerts happen all the time, and it's a very common cultural activity. And there are young people there all the time. Underage people, 10, 11, 12 years old. And so the sale of marijuana-related paraphernalia and the use of marijuana was just very, very common at these community events. It'd be sort of like having marijuana being smoked openly here under the arch when we have a few 100,000 people out there for some big community event. So what they started doing was they started taking pictures and video of what was going on, and they showed it to the county commissioners there in San Diego. And so they really made this take-back effort to change the tenor of what was going on with community events there in San Diego. They shared a lot of different negative problems that were going on. For myself, I think the solution is we really need to do some hard science research on the effects and benefits of marijuana. What we've got here is we have a situation where, by initiative petition, marijuana has been declared a medicine. Well, I don't think there's any other drug on the face of the earth that was ever declared a medicine by initiative petition. We really skipped science. And so I think we really need to go in that direction. I think one of the big problems in the world of drug abuse and drug addiction is that we don't communicate really well with people that drug addiction is not 1 + 1 = 2. It's not like I smoke a joint of marijuana and I'm instantly addicted. Now, I might be, but Joe over here might not be. So how do we make this work? It's a little complicated, but we have to start explaining to people better that, when you go to the doctor, you talk to them and they ask, well, are you allergic to penicillin or whatever? And you say no. Okay, well, then you can have penicillin or whatever. It's the same way for all of these different drugs. People react differently to different drugs. And in the world of prevention, we have to figure out how we can communicate no-use messages, because we want every young person to do well. So in that process, we go for no. Well, if we skip telling the truth that, some people will use these drugs and then they won't have these problems, but other people will use them and they will have problems, that gets to be a mixed message. So we don't like giving mixed messages. But I think we have to get honest and tell the truth of, we just don't know. And if you do that, you're going to possibly have a problem.
All right, we've got 2 more. What do you think of the idea of posting calories in chain restaurants so that people could understand more about the effects of their choices on weight and health?
I think it's a good idea. I think it's helpful. I look at that. I think it just gives people a chance to make a more informed choice.
And then, for those that didn't hear me on that last one, that was a question about posting the calorie counts in chain restaurants. This last question says, what brought about your thought of the public policy opportunity for the DWI enforcement and judicial administration? Is there a personal experience that made you express clearly the need for this subject to not go unheard?
The closest personal example of that was back in 1989. I was working in a community in Kansas. My first prevention job, I coordinated programming for 6 school districts through the Cowley County Special Services Cooperative, and it was really a fun job. But one of the problems in the community there was this annual party for the high school seniors that some of the parents would throw, and it was an all-night party and there was alcohol served. Well, one of the boys, the next morning, he was driving home at like 6 a.m. and he crashed his car into a bridge and he was killed. Now, so it was just a tragedy. And that was a case where, adults thinking wrongly but acting they thought in good faith, made a mistake and contributed to the death of a young person. So that's the closest sort of personal example that I've got that makes me think that the DWI issue is important, and that's some years ago, and that had a big impact on me. I also think that it's just a clear example of if we did things differently administratively in our legal system here in this region and in this state, a number of people would be alive now that are now dead. And so in that respect, it's somewhat of a simple solution, and it's a clear need, and it's the type of thing that, this argument this public policy issue was brought up in the early 1980s in a national level. We have great standards developed. Many states have great standards for handling this problem, but we haven't got that handled so well here. So I think it's probably somewhat heartfelt from that one experience many years ago, but that wasn't a case where a judicial thing needed to happen beforehand. That was more of an educational piece that needed to happen for those families that were involved in the throwing that party for some graduating seniors.
All right, and with that, we will wrap up today's presentation. Dennis, thank you so much. It was a wonderful presentation. I'd like to thank everybody for taking the time to join us today. For those of you who are interested in CEUs, before you sign off today, hit your refresh button on your browser. The CEU link will be there now. It wasn't there before. A couple of you notified us of that, and we appreciate it. Also, we'll send it to you in a follow-up email. Our next program is 2 weeks from today. On Wednesday, the 31st of March, we'll talk about helping people navigate Medicare Part D. That should be another interesting conversation. As always, we do most of our publicity via email, so if you or any of your colleagues would like to join our email list, please do so through our website. We'll be happy to send you notices of our upcoming web conferences, our DVD releases, and all the other programming that we do here at the Missouri Institute of Mental Health. Again, thank you for your time today, and Dennis, thanks for yours.
Thank you, Tom.